Hi, I'm Dr. Jonathan Sedeyn, General and Robotic Surgeon, Holzer Health System. So traditionally, we would use laparoscopy for a lot of our surgical procedures. Over the more recent years, there's kind of been a trend to move more towards robotics with this. Now, robotics fills the same niche as laparoscopic surgery, but with the added benefit of being able to work in a smaller space more dedicatedly. What I mean by that is that we can operate on the same patients through small incisions and do a lot more work through those small incisions than we were ever able to do before. Additionally, it helps us to reduce the rate at which we've had to convert to an open surgery for many of these patients. One of the major benefits of robotic surgery, not only in being able to work in a very small space and with very fine instrumentation, but also being able to work on a larger patient population. What I mean by that is there are some patients, typically higher BMI, very ill patients, that can't tolerate what's required for traditional laparoscopic surgery. But through the use of robotics, we're able to perform these surgeries with less stress on the patient, as well as in a shorter operating time, allowing us to be able to use laparoscopic surgery in a wider breadth of patient population. So, one of the major improvements I found through robotic surgery is specifically with hernia repairs and under hernia repairs, specifically with inguinal hernia repairs. Now, the traditional method of performing a hernia repair requires making a rather large incision, about 6 inches or so, in a patient's groin and doing the repair through that incision. With the use of the robot, we're able to perform that exact same surgery, but using only 3 small incisions, no one any larger than my pinky finger. Obviously, not only is it great for the patient because they have reduced pain, but also from a surgical standpoint, you're able to do that same amount of work in a shorter amount of time. Patients tend to get back to work quicker after robotic surgery. They tend to have less pain, less use of narcotics in the post-op period, and also a better overall outcome. In general, what I've seen in my practice is that the big difference is I'm able to get my patients back to work quicker. What I mean by that is with traditional hernia repairs, they'd have to be off work anywhere from 8 to 12 weeks after surgery, meaning no heavy lifting, not able to, participate in any other work, things like that. But through the use of robotics, I'm able to do the exact same level of quality of repair through smaller incisions and get them back to work quicker, typically in about a 4 to 6 week period. You tell somebody they got to be off work for 3 months after a hernia repair, they're going to think really hard about whether they want to get that repaired or not. If you tell them you can give them the exact same quality of hernia repair with a fraction of the time off, and that is a huge improvement for them. We have a lot of patients that are opting for the robotic hernia repair at this point in time. I think we've already seen it as more and more surgeons are getting trained robotically. There's really a push towards doing more things with the robot, specifically because we have seen that patients are having better outcomes, fewer complications, quicker returns to work. So not only are we going to see it for things like hernia repairs, but gallbladders, appendixes, colon surgery. There are even certain areas where they're doing breast surgery and thyroid surgery robotically now. And those patients are having great outcomes, getting back to work quickly, and having the same level of quality and care. So I just think that, in the future, everyone's going to move towards robotic surgery.